the female reproductive system, but they are very elusive in a way that you may not even know that you have them until it's too late. And it's suggested that over 100,000 million, let me repeat that, 100,000 women worldwide suffer from fibroids, and in Uganda here it's been put at 25% to 30% of women, where 40% of them are not aware that they actually have fibroids. And we are here to discuss this today. We have a doctor in studio here in whose custody we safely are, and we're going to talk about them and see a way forward, but also how to look out for them. What are the signs? How do they present? And at what stage should you be running to seek medical attention? You are welcome. It's NTV Medical Matters, and we are supported by Bill and Melinda Gates Foundation. And without further ado, let's dive in. And our doctor today in studio is from UMC Victoria Hospital. He is an obstetrician and gynecologist and a doctor as well. He's also the medical director at the hospital. So that is Dr. Ramin Martin Tavakoli. Is that how you pronounce your name?
Yes, yes.
You're welcome to the show this morning.
Thank you, Viola. I'm happy to be here.
Yes, and thank you so much for keeping time to be here, talk about fibroids. So let's start off with just understanding fibroids. What are they? For someone watching, we don't have a picture right now, but how would you explain them in a simple language?
Well, fibroids are benign tumors, like you said. They are non-cancerous growth that develop out of the smooth muscles in the uterus. They are not cancerous, they do not spread. Most of the times they are slow growing. They affect quite a number of women. The lifetime risk of developing a fibroid by the time you're 50 is about up to 70%. So they are very common. Wow. Amongst the reproductive age group in Uganda, we see that they affect about 28% of ladies in the reproductive age group.
I read somewhere that they're common amongst women of African descent, but truly how common is that fact? Is that statistic right?
Yes, there are risk factors when it comes to developing fibroids. The first one is the age. The bigger the age, the more likelihood of them developing. Then there is a genetic predisposition. If you've had it in the family, a first-degree relative, a sister, a mother, you are more likely to develop it as well. Then to your point, ethnicity, Asians and the black population are at a greater risk of developing fibroids. Then the other risk factors that may predispose things like obesity, low vitamin D levels, high hormone levels. For example, if you started your menstrual cycles very early and you are going into your 50s, you have a longer reproductive period and you're exposed to more hormones, so the risk of developing are higher.
And you know that conversation about hormones keeps coming up every time that we have a topic here. Yes. The last time we were here, we spoke about lupus and that suggestion of hormones actually being a part of the causes came up. So I'm wondering whether these hormones will need to be put to rest at some point. How do we actually handle these hormones?
Yes, the hormones that we talk about are the hormones within your body.
Yes.
Now, I'm sure you're referring to the birth control pills, for example. Now, those do not have the levels that are required to make the fibroids grow.
Yeah.
So if birth control pills actually prevent you from ovulating, and in a way they downgrade the hormonal environment. Yeah, so the hormonal excess we're talking about are the endogenous hormones, not the ones that you consume from the outside. Then another risk factor that's important is delay in the onset of the first pregnancy. We find that if for ladies that have had earlier pregnancies, they are less likely to develop fibroids. But that does not mean that if you get pregnant early, you are protected. No. There are many ladies who have had early pregnancies and they have still gone ahead and gotten fibroids. But the likelihood of it developing are smaller. Then also frequent pregnancies also tend to have some degree of protective effects.
Protective?
Yes.
I actually thought they dispose you to that, and as getting stressed out, I was about to ask you, so where do we run to? We can get pregnant, we can't not get pregnant. You are beginning to get confused. And so for the hormones, actually, I also wanted to know whether there is something external that we can use to sort of balance them out so that they don't create this kind of disease?
No. But if you do have an inherent hormonal abnormality, it's good to look for a possible eliciting factor, and then you correct it to make sure that the hormone levels are well balanced.
Yeah.
Yes.
And I think that's something we shall look at a bit more when we get to treatment. But at what age do fibroids typically start to develop in a woman?
Fibroids are typically slow growing. They usually start out as a small growth within the uterus. It's a group of smooth muscles that start growing a little bit uncontrollably relative to the surrounding muscles. So they grow very slowly, and that's why we normally see them in the late 20s. Most of the times, they are too small to be detected earlier in the reproductive age. So you start noticing them maybe in the mid to late 20s. Then in early 30s, they become more detectable. They become easy to see. They may become multiple. They may increase in size. Yeah.
Are there different types of fibroids? And if there are, what are they? How do they differ?
Basically, the histology is the same. Okay, the structure, microscopic structure is the same.
Yeah.
What would differentiate them is the location of the fibroids. You can have fibroids that are growing on the inner wall of the uterus, the inside wall. Those are subserosal, and as we may talk about it, those are the ones that are likely to cause more symptoms. You may have fibroids that are in the muscle, in the middle. Those are intramural fibroids, and then you can have fibroids that are on the outside lining of the uterus, and those are subserosal. Yes.
You said some of them are not, okay, they are not cancerous, which means I would imagine they are not dangerous. Can you keep them there if they're not dangerous?
Yes, they are not cancerous in that they do not have the potential to spread. They do not alter the structure, but they do tend to grow with time. And the symptoms that they produce is what usually dictates what urgency of treatment is required for the fibroid.
Let's look at the symptoms. You actually preempted that. What are the symptoms, the risks, symptoms that women should look out for?
Yes.
That when I feel this way, those could
it's
actually
time to check for a fibroid.
Yes, it's time to check.
Yes. Now, fibroids, very early on, they do not have any signs or symptoms because they are small, they do not cause any pressure or pain. But the most common symptom of fibroids are pain in the pelvis. Most ladies come in complaining of low abdominal pain. Then there might be complaints relating to changes in the menstrual pattern. For example, the periods may be heavy. They may be going on for longer periods. Then there might be complaints relating to the fertility. Because they grow in the uterus where the baby is supposed to implant, they may also reduce the potential for developing a pregnancy. Now, the other symptoms will relate to which position the fibroid is located. For example, if there is a fibroid on the front wall of the uterus, it may impinge on the bladder. It presses on the urinary bladder, and it causes the increased urge to urinate. If the fibroid is, for example, behind, it may press on the rectum, then it may cause constipation, bowel symptoms. You feel flatulent. Then as it grows out, you eventually see a swelling in the lower abdomen.
Can they exist till the final stage without showing any symptoms, but then become detrimental?
Fibroids are generally not that dangerous. They do not have stages. They do grow. They may have different sizes, but it's not like a cancer that we can say this is stage 1, stage 2, stage 3. The biggest aspect of fibroids is their size and how the symptoms they produce. But I want the viewers to be reassured that fibroids are not exactly dangerous. Treating them is never an emergency. Though, if they are present and they are causing symptoms, it's good to have them treated. But it shouldn't alarm the viewers that these are very dangerous things to have.
How are fibroids normally tested once the person comes to the hospital?
The gold standard is an ultrasound scan, the same scan that detects pregnancy. That is the cheapest, it is most readily available. Then there are other imaging modalities like MRI, but usually an ultrasound is the best.
What about blood tests or urine tests and stuff like that?
No, those do not have fibroids.
Oh, okay. So for somebody that might have been suspecting fibroids for a while, but they've left them untreated and they have really not sought medical attention, what danger is in that?
Well, the danger, of course, the pain that we mentioned, it reduces the quality of life. The pain may be constantly present or it may be during the periods. Then they may cause heavy bleeding or prolonged bleeding, and that increases the risk of developing anemia. So for ladies who have had prolonged periods of bleeding, and if the input is not enough, they may develop anemia, and anemia comes with its own risks, for example, fatigue, headaches, body weakness, and then later on you go into the more severe symptoms, body swelling, difficulty in breathing, leg swelling, and so on. But that comes in when you have gotten to the anemic phase, when you've had heavy periods for a long period.
We are going to look at how they affect periods and fertility. You mentioned something earlier about where the baby is supposed to implant, and some of them might be there, but in a case where they are on the outside or somewhere else, can they still affect fertility and the periods as well?
When the fibroids are on the outer wall, they tend not to distort the inner wall, the endometrium of the uterus. So you find that when the endometrium is regular, it is not displaced, it is unlikely that the fibroid would interfere with the fertility. Fibroids that tend to interfere with fertility are those that displace the inner wall. And in displacing the wall, they cause stretching of the inner wall, they may cause inflammation of the inner wall. And when the inner wall is inflamed, the chances of the baby being able to successfully implant is much less. Yes.
We are shifting now to risk factors and the causes for someone watching and is wondering what really causes that and how can I avoid it. Obviously, when you hear a topic like this, the first thoughts are, how can I avoid that? How can I stay on the safer side? So what are some of the risk factors, the causes, and you hinted earlier on hormones and, but what are some of the other obvious ones that are avoidable?
Now, yes, risk factors, there are those that are unavoidable. For example, the ethnicity you cannot change, family history you cannot change, but there are some modifiable risk factors. For example, obesity. If you're obese, your estrogen levels are likely to be higher. And when estrogen levels are higher, your chances of developing fibroids are higher. So obesity is something that you can modify. We mentioned that the age at the onset of delivery is also important. For ladies, if it is possible, if there is like a 50% chance of developing an early pregnancy, you'd rather go with it. Of course, there are other circumstances that come into play. You can't just start having children to avoid fibroids. But if the possibility is there, if the circumstances allow, yes, go ahead and have that child. Then get more exposure to sunlight, because some studies suggest that low vitamin D3 level is also a risk factor for the fibroid. And then also have frequent, not that frequent, but have frequent checkups in the hospital. If you go for a checkup, you can have an ultrasound, look at the fibroids. Generally, they tend to be easier to treat when they are small. The risks associated with their treatment are smaller, also when the fibroids are small.
You mentioned something interesting about vitamin D. C?
D.
From the sun, right?
Yes.
And the African skin should be able to absorb vitamin D. And I believe even when it's less, when it's rainy season or whatever, we should be able to absorb it. But I also noticed that the numbers say that African women are more predisposed to this. What is the reason for that?
Well, it's not entirely known why particular races are more predisposed to the fibroids, but it's not because of lack of exposure. Yes, we do have plenty of sunshine in the tropics. In Uganda, we have plenty of sunshine, but unfortunately, many of us do not get exposed. Like Viola, you come in office today, you're not getting any sunshine. And the majority are not getting the right amount of sunshine to build up enough vitamin D3 levels.
Yeah.
Yeah, so we see a lot of vitamin D3 deficiency in the hospitals.
So once you have a pregnancy, I understand the hormones also fluctuate, you know, but does that also put you at risk of getting fibroids after the first baby?
No, pregnancy tends to be protective. I think one of the reasons that while you're pregnant and while you're breastfeeding, you're not going through the hormonal cycles of ovulation, the rise and the falls in the hormones. So you have like that break of a year and a half. Yes.
Is there a way that we can prevent fibroids from developing?
No. There is no concrete way that you can say, "Now I'm doing this and fibroids are not going to develop." It's not there.
Yeah, that's frustrating there, because I really wanted us to find a way around it. I just don't like to have topics where we discuss and the viewers keep feeling, if I can't do anything about it, so what am I going to do? But anyways, let's move on to treatment options. What treatment options are available in Uganda at the moment? Yeah.
Well, we have the full board of treatment options in Uganda currently. Now, the treatment depends on the goals, the fertility goals, and whether we are treating the underlying cause, that is the fibroid, vis-a-vis the symptoms.
Yeah.
Now, if you have, if the fibroid is very small or if it's just causing mild pain, the treatment options range from painkillers, the paracetamols, ibuprofen. If it is causing heavy bleeding and you want to mitigate the bleeding itself, there are hormonal tablets that can, not the bad hormones, the hormonal medication that can help to mitigate the heavy bleeding. Then for treatment of the fibroids itself, there are various methods. There is the non-invasive. There is what they call the uterine artery embolization, where a small clot is formed, is incited in the blood vessel that goes and supplies the fibroid. Yeah. You see, the fibroid has a blood supply in the uterus. So we pass a chemical into the blood vessel that goes into the fibroid, and the fibroid gets starved of blood, and then it shrinks. Now, the disadvantage with this method is that it may render the uterus unsuitable for a future pregnancy because parts of it may have become less functional. So this would be a good option for a lady who has finished her reproductive potential, does not want to have children. Then there are surgical methods. For example,
we shall talk about the surgical methods, but before we go too far, I just want to take you back a little bit, and that's on the periods. So what would a doctor consider heavy bleeding or heavy periods?
It's hard to measure, but we consider more than 80 mils. It's very hard for you to measure how many mils you're bleeding.
Would you say maybe how many pads?
If you're filling up more than 5 pads in a day, and your periods are going beyond 7 days, those are heavy periods.
We've had cases of people who have interfered with their periods and they have actually cut them off by swallowing, I don't know what they swallow, but I've heard of that.
Yes.
How dangerous is that?
Like hormonal tablets that
They just stop the periods for, you know, they just stop the periods.
Yes. Now, there are medicines, there are hormonal medication. They call them the GnRH agonists. They are administered through an injection, and they stop the periods, like you said, for varying amounts of time, depending on the strength of the injection. Now, the trouble with that is that it can bring menopausal symptoms because you're no longer producing the estrogen that is required to maintain the integrity of your reproductive system and the whole body at large. So when you use those medications, you actually end up with menopausal symptoms. You get hot flashes, you may get weakness in the bones, you may get weakness and wasting in the muscles. So those are not medications that we use for long-term treatment. They are used for, say, shrinking fibroids before surgery to minimize blood loss during the operation.
And after such a treatment or such an intervention to stop someone's periods, can they actually go back to normal and have children later on when they decide?
Yes, but unfortunately, once the treatment is stopped, the fibroids grow right back.
Oh my goodness.
So it's not a long-term treatment. It's just a short term to shrink them and allow for a more definitive treatment to take place.
And I meant for somebody that might have a normal uterus functioning, but they decide to do that just for them to stop their periods.
Yes, yes.
Do they go back to normal?
Yeah, they go back to normal once the medication is stopped.
Okay. So how does a doctor decide between when to carry out a surgery and when to start the patient on, you know, the first medications that you talked about?
Well, if the fibroid is small, it's not causing any symptoms, usually it's good to have a follow-up scan in a few months, maybe in 6 months to a year. If the fibroid continues to be small and has not caused any symptoms, that fibroid can be managed by observation through repeated scans once a year. But if the fibroid is causing symptoms, or if it is showing signs of rapid growth, then there can be plans put in place to have it treated.
There is something I'm seeing here called hysterectomy. Hysterectomy.
Yes.
Okay, so that, is it necessary for, is that something you consider each time somebody comes through with fibroids?
No. Hysterectomy is about removal of the uterus.
Yes.
So it's usually done when the fibroids are very large, when the lady has no plans to have any children in the future, or if it's done in an emergency setting. One of the risk factors of treating the fibroid, surgical treatment of the fibroid, is heavy bleeding.
Yes.
So if during an operation to remove a fibroid, we notice that there is heavy bleeding and it is putting the life of the patient at risk, we may choose to save the life by removing the uterus. So it's not always the goal to have a hysterectomy done. Though it may be done for patients who have already finished their reproduction and they don't need the uterus anymore. So the hysterectomy has the additional benefit of protecting you from cancers of the uterus after the menopause.
Wow, that's actually good. I was thinking about the shrinking of the fibroids. When you go for that alternative and you're shrinking them through injection or whatever medicine you're administering, how long does somebody have to stay on that medication in order to keep them shrunk?
Now, like I said, it has the side effects of menopause, so you don't want them to be on it for long.
Yeah.
So we do not want you to be more than, to spend more than 6 to 9 months on them. So usually after 6 months of treatment, we see a 30 to 40% reduction in the size of those fibroids. And that usually tends to translate in less blood loss during the operation.
What happens when you stop the medication on a shrinking fibroid?
Well, once you stop the medication, the menstrual cycle resumes and then the fibroids grow because they're hormone dependent. They depend on estrogen and progesterone.
Oh.
So once your ovaries start producing the estrogen and progesterone, they start growing. They get back to their original size.
It's actually very heartbreaking, you know, when you talk about the fact that even just reducing treatment or stopping it may actually trigger, you know, what breaks my heart is the fact that it's the hormones that trigger this. So it's like you stop medication and the hormones just come right back and they could trigger others, yeah. But we are going to find a way around this. I just want to remind you that we shall be having phone calls. You can speak to our doctor here, Dr. Martin, and he's here discussing fibroids, trying to help you and I understand what they are, what you should do. But even though they just happen and you can't do much about it, there is ways to manage them. So we shall take a break, but be ready with your questions. When we return, we shall be talking to you. You can call the doctor directly and speak to them. Also at social media at NTV Uganda, you'll be able to be a part of the Welcome back from the break, and thanks for staying with us here on NTV Medical Matters. I am Viola Sasira. We are supported by Bill and Melinda Gates Foundation, and this chilly morning we have Dr. Ramin Martin Tavakoli. He's an obstetrician and gynecologist and medical director at UMC Victoria Hospital. We are discussing fibroids, and he said something very interesting during the break, that it's not an epidemic of fibroids, so please don't be alarmed, but this conversation is necessary. So I hope that you have your questions ready. But for now, as we wait for your calls, we shall come back, Dr. Martin, speaking about the influence of our diet on the potential to develop fibroids. How does our diet play a role in this?
The diet, that's a very good question. Foods that predispose you to obesity. We said that obesity is one of the risk factors. So if you consume high energy foods, high carbohydrates, high fat, you are more likely to put on weight. When you put on more weight, you have more fatty tissue. When you have more fatty tissue, you are likely to have more estrogen levels. So the estrogen levels are likely, high estrogen levels are likely to translate into a greater risk of developing fibroids. So we need to reduce on the carbohydrates, include more proteins, include more fiber, reduce on the starch, reduce on the sugars, yes. And then of course get regular exercise.
When you speak about fat, you know, it got me thinking, are fibroids actually fat or are they muscle?
No, fibroids are smooth muscle. The uterus is made of muscles. Those muscles are designed to aid you in the delivery time. They are flexible enough to allow it to expand during pregnancy, and yet they are resilient enough to be able to cause contractions during labor. So it is a group of smooth muscles in the uterus that somehow get the autonomy to overgrow the neighbors, for lack of a better word.
That's very true. Let's look at the impact of fibroids on women's lives. Diane, you said it's not an epidemic. We are fine, really. We are doing well, but we need to keep on the lookout. However, how do fibroids affect a woman's life? Say, for example, I've been diagnosed today, God forbid. What happens to me after that? What's the extent of the effect on my life?
Largely nothing. Like we said, it's not a cancerous disease. It's not an epidemic. Fibroids have always been there. They will continue being there. A good proportion of ladies will eventually have fibroids. They have always had fibroids. So if you do an ultrasound today and you find there is a small uterine fibroid, it's not cause for alarm. If you have not been having any symptoms, you will probably not have symptoms soon. So you should not be alarmed. Just have a consultation with your doctor and see if yours requires treatment. Okay. Because not all of them require treatment.
Our callers are beginning to come in, so when we have one, please do let that person through. My producer, we have somebody on the line. Hello there, what's your name and what's your question?
Hello, how are you?
I'm good, how are you? What's your question and your name?
Yeah, my name is Farida.
Yes, please.
My name is Farida, and I have a question.
Pardon?
I have a question about fibroids.
Yes, please, go ahead.
Yeah, I wanted to know, I went to a certain hospital, I was checked, and they said I had a small fibroid.
Yes, please.
Yeah, that doctor told me that the fibroid was about 3-4 centimeters.
Yeah. So what is the problem?
Yeah, he told me that they will have to do a surgery and remove it. I don't know whether it is necessary because I don't feel a lot of pain.
Oh. Thank you, Farida, for your question. Yeah, that's Farida. She has a question about whether she needs a surgery if she's not feeling too much pain about the on the fibroids. We have another phone call. Who is there on the line? What's your name and what's your question?
Hello.
Yes, please. What's your name and what's your question?
I'm great to have a contact of that doctor.
Yes, please. Okay, he's off. No name, but he would love the contact. So if we have another caller, please let them through. And okay, so you have space for 5 calls, and then we shall go back to the discussion. And
Hello.
Oh yeah, we have somebody. What's your name and what's your question?
Hello, my name is Hadija. Thanks for the show.
Yes, please. You're welcome.
Yeah, I wanted him to talk about fibroids and abortion plus the pills.
Plus the pills?
Plus the pills.
I don't
Emergency
get.
pills.
Is that pills? I don't get the last word. Emergency pills. Thank you. Thank you. Thank you for your question, Hadija. So this is your moment to call in and ask about fibroids, but we shall first go with the... Oh, there is somebody, actually. What's your name and your question?
Yes, please. Good morning.
Good morning to you. What is your name and your question?
My question is one.
Pardon? There is noise in your background?
She's Onesmus calling in from Bara.
Yes, please. What's your question?
Apart from surgery, is there any treatment that you can give to someone with fibroids?
Okay, thank you so much for that. We have, I love our callers. Our callers are coming from so far around. Yes, from Bara. So somebody else is there. What's your name and your question?
My name, I'm called Magom Henry. I'm calling from Bali.
Yes, please, Henry. What's your question? Oh,
I want to know about my hand. My hand is full.
I can't hear that. I think the network is being interrupted. I don't hear him clearly, but the lines are open. Feel free to call in. The number is on your screen. And when you call in, step out from your TV set. Yes, please. What's your name and your question?
I'm Viola from Masaka.
Yes, please. What's your question?
I wanted to ask if abortion causes fibroids.
Thank you, Viola. We appreciate your question. Okay. One more caller, and we get into answering your questions. If you're there, what's your name and your question?
Hello.
Yes, please.
This one for me, they told me I have a myoma in the uterus.
Pardon? Please repeat that.
I have a myoma in the uterus.
Yeah.
And I'm not conceiving, so can I get the number of that doctor?
I can't hear you clearly.
I'm calling Nancy Madina from the Sahara.
Yes, please.
Yeah, they told me I have a myoma in the uterus and I'm not conceiving.
Oh. Okay, so what would you like to know about that? I think she got off, but we shall have to talk about that. Yeah. Okay, so we are going to first answer these questions, but please keep bringing them more. Our doctor is here, and you can ask in any language you're comfortable with. Just hit us with Runyankoli. We shall answer. I'm kidding, but yeah, let's start with these ones, and then we shall get back to our callers. So I saw you noting down.
Yeah, I noted some of them.
Thank you.
The first caller, I think she was Farida. I must start with the disclaimer.
Yes.
It's very hard to make a treatment plan from very far.
Yes.
She mentioned that she had a fibroid that was, I think, 3 to 4 centimeters.
Yes.
I would say that is not big, not small. It is somewhere average, probably between small and average. So there may have been something that compelled the doctor to propose surgery. But if it's not causing symptoms, if it's not growing very fast, there is room for observing that fibroid. It may not always require surgical intervention.
And you mentioned something very important. I think they have to monitor the growth, and you know, a doctor always has a better, you know, understanding of this. But she feels no pain; she's just normal. But I guess with the fast growth, it can result into something bad. So, yeah, the monitoring is very important.
Yes.
Okay, so Farida has to monitor. Keep going to the hospital and monitoring the fibroids.
Yes. Without being on tension.
Yeah, no tension.
Yes. Then there was a question regarding, I think, the relationship between fibroids and emergency pills. I don't think there is, unless you take emergency pills every week. So if you take an emergency pill once in a while, once every 3 months, there shouldn't be a problem with that. Then there was a question regarding if there is any treatment apart from surgery. Yes, there is surgery. There is non-surgical treatment. You can have the symptomatic treatment to control the pain, control the heavy bleeding. Then you can have uterine artery embolization, the one we discussed.
Yes.
Then there are more advanced treatments that are not yet available in the country, like radio frequency ablation. Like sound waves at a very high frequency are directed towards the fibroid, and those tend to slow its growth. Then there was a question regarding abortion and fibroids. No, there is no relationship between abortions and fibroids. Though fibroids may increase the risk of you getting a miscarriage. Then myoma and conception, yes, there is a documented risk of difficulty in conception when fibroids are present, especially if they are on the inner wall, if they are submucosal, and especially if they distort the endometrium, if they are big enough to change the shape of the inner wall.
What is myoma?
Myoma is the fibroid.
It is a fibroid?
It is a fibroid. It's just a scientific term for the fibroid, yes.
Okay. So she's struggling to, does she have any chance to conceive?
Yes, she does have a chance. One, we need to establish if the reduction in the fertility is indeed because of the fibroid. Because you may have the fibroid that is there, but there is a different factor. For example, you might have blocked tubes as well.
Yeah.
You might have a male factor as well. You may have ovulation dysfunction as well. So the first thing is to establish the actual cause of the infertility. If it so happens that the fibroid is the cause, then it can be treated.
Yeah, thank you for that. You know, it just puts everything into perspective. You may think it's the fibroid when you actually have some other reasons as to why. Yes. Wow. So that last question, please make sure that you're sure it's the fibroids that are affecting your fertility. We spoke about the diet. You told us what to avoid, but it's also very wise to tell the people what to go for, what to go for, what to have more of. And also, you know, we are in a very modern world now, and a lot of these foods have been put into capsules. So what are some of the supplements that somebody can use in case they cannot eat the food you were talking about? Okay.
So the supplements, we mentioned vitamin D deficiency, so definitely I'll start with that. You can have vitamin D supplements. There are capsules that can be taken either daily or once a week. So if you're an office employee, you don't get much outdoor light, you can pass by the hospital, have your vitamin D3 levels checked. If they are low, you have it supplemented, because that's one of the few proven relationships between fibroids and nutrition. Then the things you can have more with salads. You can have generous servings of salads instead of carbohydrates, instead of a full plate of rice or potatoes, matoke or posho. You can have a small portion of the starch and like half of the plate being covered by greens. Dodo, nakati, spinach, cabbage, lettuce, broccoli, onions, tomatoes, carrots. Then of course proteins. Proteins are good because they have a filling effect. You can have chicken, fish. They tend to give you that fullness so that you don't need to overload with starch.
What psychological and emotional impacts have you observed among women that have come to you that are struggling with the fibroids?
Well, the psychological aspects normally come into play when there is a desire for fertility and the fibroid is interfering. Yes, so that is quite significant. But then there are people who get the initial alarm. They get to know that they have a fibroid. They do not know the implications. They think they have to have the surgery immediately. So it comes in a lot of anxiety. Good thing at the hospital we have a range of services, including psychologists. So we are able to deal with those as well.
I am looking at a question here that says, why is constipation so high in women that have fibroids? Is that a fact? Have you come across it?
Yes. Now, fibroids that are on the behind wall of the uterus, which we had a diagram. But if you look at the anatomy, the uterus sits just in front of the rectum where the stool passes to come out. So when the uterus is gravid with fibroids, when there are many fibroids in the uterus, it tends to press on the rectum, and that slows down the transit of food outside. So it slows down how the rate at which stool can pass. So it causes constipation.
Okay. Yeah, it's good to paint that picture. And you said, Bush, we had a diagram. The next time we should have a drawing to show this. We usually have them. We just never got this one. But as we come towards the close of this, we have one right there. Very good, amazing.
That's amazing.
Yes, so somebody is able to tell. So this is the front.
Yes, that's
the back is on the other side. Yeah. Okay, so for someone who wanted to understand more, look at that diagram there. Is it a diagram? Is it a photograph? Is it a painting? I don't know what it is. But yeah, you can look at it and yeah, you can. So when your fibroid is at the back.
Well, yeah, when you're looking at a cross section here, this is a sagittal section. So if the fibroid is beyond the fundus, it's behind, then those are the ones that are likely to impinge on the rectum. Yes.
And cause constipation.
And cause constipation.
Okay, so what are some of the misconceptions, the myths that you have heard about fibroids and you would like to clear today?
Well, the most important should be about it being cancerous. It's not cancerous at all. Then the treatment, it's not true that every fibroid requires treatment. So we need to have it properly evaluated, and when it requires treatment, it's good to have it done at a hospital with a wide range of services, so that if there is an issue that arises, it's easy to treat.
We did an interview some time back, I think it was last year, with a lady that's living with endometriosis, and she was going through it. She lives alone, she has got a different diet, she does not go to work, she just has something really terrible going on. And that got me thinking, when I remembered her case, as we discussed fibroids, how can families and communities surrounding these women help them when somebody has been diagnosed and is on treatment, knowing that it won't get cured anyway, but how can we as a community support these people, the patients?
Well, of course, the smaller asymptomatic fibroids, they will not be noticed. So I don't think there will be any need for the community support. But for patients that have the bigger ones, the ones that are symptomatic, the ones that have gone ahead and caused anemia, then those may require support, nutritional support. And then fibroids that have caused anemia may also impact on the performance of these individuals at work. People who have anemia may get tired easily, may get headaches easily. They may not be able to produce the same sort of results at work. So understanding at places of work may also be important. But that is, of course, up to the individuals to disclose. Yeah, but like I say, fibroid is not something that should be stigmatized. It's something that is relatively simple. I don't see a scenario where the community gets involved.
We have a caller. Yes, please.
Hello.
Yes, please. We can hear you. What's your name and your question?
I'm Martin from Cavalry.
Yes, please.
But I speak Luganda.
Okay.
Mwanyina ziva mulongosa nga musala obuseke. Naye ndoza nabana tebamujja siri nnyo kumbaza nti na nnimmeezo. Naye alina risiki y'okulwala fibroids. Tebajjamu n'abaana basala buseke, basala kaseke oba wano akaseke kamu.
A C-section. Bacola C-section.
Yeah.
Oh, okay. Thank you, Martin. Yeah, Martin is a bit worried about how his wife, she had a pregnancy, she delivered by C-section, and he's worried about whether that can. Oh, they cut the tubes. I think I didn't hear clearly. They cut the tubes, and so he's wondering whether that can actually put her at risk.
No, not at all.
It does not?
No, no relationship at all.
No, okay. And since I spoke about, since I also spoke about, do we have a caller there? Oh, the network is very poor for that one. But I was saying, since I brought up C-section, does that also play a role?
No.
It does not.
Well, some fibroids may increase the likelihood of having a C-section. For you to deliver normally, the baby needs to be in the right position and right presentation.
Yeah.
So fibroids, because they may distort the...
I saw a picture.
Yes,
there.
they may distort the uterine cavity. The baby may not always present with the right position. So they may increase the likelihood of a C-section.
Okay. We have a caller. What's your name and your question?
I'm called Wamoli Godfrey.
Yes, please.
I'm called Wamoli Godfrey.
Godfrey, what's your question?
My question is, whenever I go for, I have a problem with my back. I have a problem with my backbone.
Yes. Please go ahead.
But whenever I go for a scan, they tell me I don't. Whenever I go for a scan, they always tell me I have no any problem, but I feel a lot of pain.
Okay, thank you, Godfrey, for your question. Do we have another caller on the line? If we, wow.
I'm guessing Godfrey's problem has nothing to do with fibroids.
Oh my God. I did not want to be the person to say that because I really want to be very hospitable to my viewers. Yes, please. What's your question? What's your name?
Kamal Jackson.
Jackson, what's your question?
My wife has a blocked U-tubes.
Yes, please.
Fallopian tubes. Can she be helped? Maybe I have a contact for that doctor.
Okay, thank you. Thank you for that question.
Okay, thank you.
Another caller. We need about 5 callers so that we can. And we shall, and just to allay your fears, Godfrey, we shall bring a doctor for back pain. My doctor immediately said, no, that's not it. But we shall bring that doctor. So we have another caller. Yeah, what's your name and your question? Yes, Gerard. Oh, no. Oh, every time that happens, it breaks my heart. Any other caller there before we get back to... I just want to know the advice you give to women, but we shall have to first talk about this. For the backbone, spinal cord problem, we shall bring a doctor about that. Yeah, we need to move on. So let's talk about the backbone thing is on the side.
Yes, yes.
Yes. What was the other one, the other question about fibroids? I did not write them down.
Yes, yes.
We have another caller here. Okay, so what's your name and your question, please?
My name is Nakalima Dana.
Yes, please, Diana.
Monday in that program, gender law and name on and now it's a bull, gender bull that doctor. And then in a fibroids, one on goes our cocoa. Nae bakire kamu bane kamu fibroids chali chinene none bakire kamu ne sometimes mbera onimpira control zenga mungi simanyo ba nayo style ya fibroids.
Okay. Kale webale Diana. Okay, so Diana's thing is about a surgery, but they left the fibroid in and it causes her to feel dizzy from time to time. She's wondering whether it could actually be the one causing her to feel dizzy all the time. But I wanted us to first complete the tubes. The question was about the tubes. So the lady got her tubes cut or whatever they do to them or tied. Tube ligation. You said that is not related at all?
Not at all, no.
It's not related.
No.
So she
by BTL,
yes,
cannot in any way affect your fibroids.
And I had a question before we get to this, to Dana's question, about the baby. You mentioned the baby sitting in the right position or the wrong position, depending. And I would ask my producer to have that picture again on screen, where I saw the fibroids were penetrating the uterus, you know. It got me thinking, can those fibroids injure the baby, causing distortion in the baby's formation? Yeah, something like that. If you go ahead and get a pregnancy, and this is your uterus at the moment, does this pose a risk to the baby's formation?
Well, there are risks. Initially, of course, the risk is difficult in conceiving, but when you conceive, the risk of a miscarriage is also higher.
Could the baby go ahead and develop in the midst of this and then
yes, baby can develop because these, much as they look big right now, the uterus is quite elastic, the uterus expands.
Yeah.
But the risk of a miscarriage is increased, and then also the risk of having a preterm baby, preterm delivery is also higher.
Yeah.
But no, they do not press and cause damage.
I was so worried.
No.
All right, so let's go ahead and talk about Diana's issue.
Now, Diana, I think she said they operated, they left some small ones.
They left one there. She said a big one, actually.
Yeah, she had a big one removed, then a small one.
There is another big one that they left there. One. Yes.
Yes, so now if there is another big one, it could be that the big one is causing heavy periods, and the heavy period is the one that is causing the dizziness. So it's easy to have that assessed. We need to do a CBC to look at the hemoglobin levels, and maybe also have the scan done once again to see how big the fibroid is. But yes, during the operation there are times when there is a very tiny fibroid
that you leave.
That you leave because removing it poses more risks.
You talk about having a test of hemoglobin. What else is supposed to be tested, actually? That is a question that I'd forgotten. What is supposed to be tested? When I go to the hospital and they say, I think I have fibroids, and I go through that test, whether it's positive or negative, what other tests am I supposed to have as a woman?
Now, well, as a woman, you should have a pap smear done every 3 years. That's very important. Not related to this topic, but equally important. Then, so if you find that you have a fibroid, you've gone to the hospital, you have a fibroid, you need to check your hemoglobin to see if the fibroids have been causing you to have heavy periods. If the hemoglobin is low, then you get iron supplementation. There are medications that can reduce on the flow of the blood during the menses, so you can benefit from those. Then additional tests, I don't see how they are very relevant unless now you're being worked up for surgery.
Yeah.
If now time has come and we've decided that we need to remove these fibroids, there are additional tests that can be done. Your blood group, HIV status, hepatitis, things like that.
Thank you. What can you say to the ladies watching this morning who have been with us on this show since we began this very, tough conversation, really? I kept distorting my face because, I can imagine the pain. I actually picture what that would feel like when you have them and they're taking you through that pain. But what last words do you have for the ladies watching? What should they know? What should they do? Just to calm them down from the pressure of this.
Okay, well, the message should be not to be alarmed. These are innocent growth most of the time. They should not create anxiety. If you discover that you do have a fibroid, pass by the hospital, have them assessed, monitor them. Those that require treatment, the treatment options will be offered to you. Those that do not require treatment, you'll be advised on how soon, how often to follow them up. But don't be depressed, don't be anxious. This is not an epidemic.
So, Dr. Martin, we've come to the end, and a lot of people are asking for your contact, or for a contact they can call in case they have further inquiries. Are you okay with that? Would you like to give them
yes, absolutely.
Okay, go ahead, please. Your camera is here.
0758 06 5141.
Please repeat it.
0758 06 5141. Or you can call the hospital number and yeah, can appointment.
Do you have the hospital number?
I'm going to share it with you.
Okay. And what I can say, he's going to share that with me, and I'll take it to our episode on YouTube in the comment section. I'll put that number there, so please make sure you go there and watch, so that you can relearn this, but also pick the number from there. So once you give it to me, I'll take it to YouTube. NTV Uganda on YouTube in the comment section is where you'll find it. So thank you very much, Dr. Martin. It's been a pleasure having you this morning and for your insights into fibroids. We hope to have you again on this show. And for you, dear viewer, always being a part of us, it's so amazing. We have come to the end of NTV Medical Matters today's episode. I am Viola Kusasira.